next week, I would try G1 technique. It's quite interesting. So we move to the next topic. So the next topic is nailing of the pilon fracture. So by my close friend, Dr. Kai Cheng Lin.
Okay, good morning, everyone. Dear moderator, chairman, and dear my friend in all over the world. It's my great honor to be here to present a case. Present a topic about is nailing pilon fracture possible. I'm Kai Cheng Lin from Taiwan. Actually, I have been here for the third time. I would like to say great thanks to the scientific committee of TOTS to invite Team Taiwan. And this is last year in Chiang Mai. We have a great camp here in Thailand. And regarding distal tibia fracture, include extra or intra-articular fracture. In my practice, I would like to use nailing more than plating because sometimes, just like in these two cases, there are several kinds of soft tissue problems if you do, even though you have meeple plating for distal tibia. So I learned from these two cases for distal tibia fracture, plating can have more soft tissue problem in my practice. And I think extreme tibia nail can be an alternative choice for distal tibia fracture. For extreme tibia fracture, this is a case series in United States. They have 54 cases, no complication of implant failure, and is safe. For this is the first paper to mention about the extreme nailing for distal tibia. But in this case series, that's extra-articular, like this. And let me show you two cases. This is a 38-year-old female. She had a spatial problem of anorexia, which is the patient is very thin. So I think it's not proper to use plating for this distal tibia fibula fracture because she is very thin. And I use nail for this patient. The tip one is like Professor Kim just mentioned. I like to use a blocking pin, 2-0 or 3-0 blocking pin to nailing distal tibia. And tip 2 is because the nail should be put very distally, and the distal segment is very unstable. So sometimes it's not easy to maintain and to keep the reduction. So I use a small band of the guide wire to make sure that the reduction can be maintained. And the other thing is flexible nail will not pass the band wire in this situation. And third one is a nail of the distal part of the nail should be at the center of the AP and lateral view in Siam. And last one is I choose a shorter nail to make sure I can provide more stability for this kind of fracture. And tip 3 is I didn't rim the distal part of the nail and put the nail shorter to make sure the nail can be as far as possible. And this is the result in 6 months. You can see the soft tissue it's not a problem of nail. And this is the first paper from Seattle Harborview that Professor Sean Locke said that maintenance of reduction during this nailing is very important because when you do nailing a very distal tibia fracture, the short segment can be very hard to reduce. And this is the difference between nail tibial diaphysis and the nail distal tibia because the distal tibia is a wide tibia segment, so and the short tibia segment, so it's not very easy to control by nail. And this is another case. It's parietal tibia fracture. Left side is a pilon fracture, and patient was referred from other hospital, and he got a infection of the left side due to he was falling down to a ditch and then got a terrible infection. And for this patient, I think right tibia is easier for me, so I do nailing. After 2 days, he was referred and STHG for the right side. What is interesting for this patient is because the medial wound is somewhat infected, so I use a lateral medial screw, which is also work for tibia nailing. And then let's go to the left side tibia fracture. First, I changed the external fixator because the external fixator in outside hospital was infected and not suitable for this situation. And I put some pin and I changed the external fixator. And you can see the lateral wound is not so good because of the Clostridium infection. And after several days of control of infection and debridement, I decided to do nail. And this is the result of the nailing. And the CT scan show acceptable reduction of intra-articular fragment. But I think for this patient, the pilon fracture, the intra-articular fragment is not so difficult to reduce. And the other thing is you can use interfragmentary screw in the distal locking screw to control the distal fragment. And it still work for providing stability of the pilon fracture. This is post-op 1 year follow-up. And the wound is stable and not infected anymore. What I learned from these two cases is even in pilon fracture, nailing can be an indication for complicated soft tissue cases. And this is the first paper mentioned about the nailing pilon fracture, but this is a case series from Dr. Mashu, and it's the conclusion is I'm nailing is a reasonable treatment option for low-grade pilon fracture, but all of the case they recommend to do this kind of nailing for in experienced hand surgeon. So I think if we want to do nailing pilon fracture, it should have some simple case to practice and then to overcome the learning curve of the pilon fracture, and should have some simple case before. Because in nailing pilon fracture versus plating, we all know mal reduction and can be more than plating. Like this paper, and if you want to do very distal nailing, and it's very common to have valgus and provocant deformity during nailing procedure. And the risk factor of the malalignment after distal tibia nailing is two. The first one is it can be first is night surgery or weekend surgery, which is not suitable for this complicated surgery. Second one is more important because distance of fracture can be less than 5 centimeters. So it can be the reason of the mal reduction and mal alignment. So this is a nice paper mentioned about the docking point or the endpoint of the distal tibia nailing. I think it's nearly center of the tibia nailing in the distal segment. It should be suitable for most of our case. Let me share you two cases of nailing tibia fracture. This case one is a 42 years old male. He had a fall during work and got an open fracture in the medial side. It's very common in pilon fracture, and the fracture is comminuted. So this is very distal tibia fracture, and what I'm concerned is a tattoo in this patient. And this is a strategy I plan to do stage 1 to stage 3 for this patient. And stage 1, I do debridement and external fixator, and stage 1.5 on day 5, I do fibula plating, and I'm not sure the wound condition can be safe and enough. So I wait for several days because media wound culture is positive and use antibiotics. And on stage 2, I do nailing pilon with external fixator to maintain the reduction. And because it's a pilon fracture, so I put clamp. It's very important to maintain the reduction during a whole nailing procedure. And this is nailing procedure. And one thing I put, because it's very distal, extreme tibia fracture, so I put another one-third tibia plate, which is small profile, not to be infected anymore. And this is the follow-up. And this is image, and because of bone defect, so I do bone graft at the 4th month when the soft tissue is safe for bone graft. So this is, I do nailing because I want to away from the tattoo. And second one is I put plate, interlocking screw through the buttress plate to provide more stability. Last case is a 46-year-old male at a fracture, and I do some blocking screw and intervertebral screw to provide stability for nailing pilon fracture. So last thing to remember is main indication is it should be not so comminuted because too large a fragment can be reduced and allow interlocking nail. And take-home message is pilon fracture with compromised soft tissue problem are good indication for extreme nailing. I think plating is still the main treatment for pilon fracture, but sometimes if you have a compromised soft tissue problem, nailing can be an option. And the adoption of the condition is at least about the locking screw to fix the distal part of fracture should be at least 2. Ideal is 3 locking screw. And the alignment and reduction can be a problem and should be avoided. And center or alignment, a guide pin and nail can be a solution. So last one is indication. It can be not very suitable in multifragment pilon fracture. I very thank Thailand since 2018. I'm here for my AO meet expert to shadow with Professor Tirasha. This I didn't see him, but I say my great thanks and great regard to Professor Tirasha, and thank you, Thailand, for the friendship. This is my presentation. Thank you very much.
So thank you very much, Professor Tai Ching-min, for your very great summary of the nailing in the pilon fracture.